Hello and welcome in nursing webinar session. Myself Shanti Bhattacharya. We are going to have continuation of orthopedic series this month. We did only few in the month of July, and today the session is all about the very prevalent sports injury, nothing but ACL, which is anterior cruciate ligament, and its management. It is an honor and privilege to share the session with Dr. V. Ram Reddy Garu, who is our expertise and he's our senior orthopedic robotic clinical director and eminent expert for knee and hip surgeries. I welcome you, sir, and thank you for accepting the webinar invite.
Good afternoon. Thank you.
And let me also welcome Ms. Pushpa, who is our dedicated and very energetic nurse manager who heads the medical surgical ward. I welcome you, Pushpa.
Very good evening, ma'am. Good evening, sir. And this is Pushpa from Hitec City. And thank you for giving me this great platform to speak in this webinar, ma'am.
Yes. So we can just go to the slide, the number 2. So this topic is a little bit, this diagnosis and this condition is not much known to the nurses. So the first question we would like to, have your opinion on, the prevalence of the ACL and why common among, female players or athletes. So we would like to know from your answer.
When you take the prevalence, we are talking about sports only, all right?
Yes, sir. Yes.
In sports, if you take 10 elite players, 2 out of 10, that's 20% at any point during their career will have ACL injury. That's 20% of the players.
Yes.
Okay. Now, why women? It's true, the ratio is more than 60% in girls as compared to boys. Okay, 60-40. Why does this happen? If you look at it, it's the hormones which play a major role. Girls in general, they are short. There is laxity of the ligaments. When you say laxity, they are stretchable. Okay.
Yes.
The third thing is if you take the thigh bone and the tibia, the thigh bone, the notch is very narrow. So the ligament which goes through the notch, when they play the sports, it impinges on the notch and the risk of tears are high.
Yes, sir. Please.
So it's a combination of several factors, the hormones, the laxity of the ligaments, the height, and the narrow notch.
So that contributes to the anatomical features in the female. Yes.
Anatomy and physiology.
Physiology.
Okay. Yes. Both put together.
Yes. So let us see what we have in the rest of the session. Pushpa, over to you.
Yes, ma'am. Thank you, ma'am. Now, today we discuss about the anterior cruciate ligament is not about ACL, a tear or sprain in the center of the knee. So we can see in this image, there is a normal ACL and torn ACL also. And in this, the side image also, we can see an anterior cruciate ligament tear in detail.
So, sir, again, we would like to know here, is ACL, is this injury is a very serious, and how long one should wait for the surgery, or when they should come to the hospital? Sometimes if we get to see people, or some patient, they just have the old injury, but they do not come to the hospital. They just manage their activities of daily living just like that. So.
Yeah, that's a good question, Shanti. Most of our patients, they come quite late.
Yes.
Right?
Yes.
And the reason is quite simple. They think it's a normal sprain. Right? Now, how do you diagnose ACL? Whenever there is an injury, sometimes patients, they hear a popping sound. Number one. Even a small twist, you miss one step while walking up and down the stairs, you can cause ACL tears. Road accidents can cause it. Okay. So it is hyperextension. The knee stretches out and then rotates. That is a mechanism of ACL injury. One of the common findings is swelling of the knee joint. So if patients feel that there is swelling, not able to stand, that means if there is a feeling of instability, associated swelling, then they should visit the hospital as soon as possible. Don't wait. Okay. There are some doctors who say we can't get an MRI scan because there will be a lot of blood in the knee joint. That's not true. MRI will give accurate results even on the day of injury. Right?
Yes.
Now, another reason why I tell the patients to come early, it might not be associated, just isolated ACL tear. There could be an associated meniscal tear or the joint cartilage injury. So this joint cartilage injury and meniscal tears, they need surgery as soon as possible. Whereas isolated ACL tears, we usually wait for 4 to 6 weeks till the swelling settles down. Okay.
So a person who is injured at this spot, so what precaution would you want that person to take and come to the hospital? Would he or she should, weigh the, leg or like partial weight bearing, or how they should come if they are just walking?
Whenever a person gets injured, you don't know whether it is a fracture, whether it is one ligament injury, or whether multiple ligaments injuries. We just don't know. So the best thing is to splint the leg, splint the knee joint, use an immobilizer, avoid weight bearing till a proper assessment is done. At the site of injury, give painkillers as necessary. Apply ice packs.
Yes.
What we call RICE therapy, RICE, rest, ice, compression, and elevation. All right?
Yes.
That's the best policy till further assessment is done in the hospital.
So RICE is very, great acronym whenever we contract these kind of knee injuries or any kind of bone injuries. So nurses, you can just learn this and try to give this first aid whenever you see any injured person. Rest over to you, Pushpa.
Yes, ma'am. So let's see the causes of the ACL. During sports or any activity that involves sudden stops or changes in direction, jumpings, etc. Sports like soccer, basketball, football. And we can see like how already sir told to us in RTA cases, simple twisting of the knee on uneven surfaces, unsupervised fitness activities. Yes, ma'am.
So, sir, is there any specific age group or teenagers who contract these injuries?
It's prevalent in all age groups, right from childhood till old age. Now, it is very common in adolescent, 14 to 20 years of age, and then in the middle age groups because they play a lot of sports. As you go to the 40s and all, it's usually road traffic accidents and domestic, like uneven surfaces, slip in the bathroom, staircase, right? Wet floors. These are the common modalities of injuries. Now, you put a slide showing unsupervised fitness activity. Yes. This is a very, very common problem nowadays. We have got so many gyms, fitness centers, where there are trainers who don't know the anatomy. They just put on very loud music and push each and every individual to the maximum possible limit. Now, we have to understand that every person is different. Every person's body is different, the fitness levels are different. If you put up the same level of intense training program, then injuries are bound to happen. So the workouts have to be customized to every individual. So a proper assessment is necessary to see whether there's any stiffness, whether there's any arthritis, whether there's any laxity, any weakness. The medical problems like diabetes, thyroid, all these play a role. So whenever I see people, I advise them, don't just go for, centers where there are only trainers, but there have to be fitness trainers who have been taught. They should have their qualifications and expertise. Then only it is safe.
So do you get to see your patients who would take your opinion before they start the gym activity, sir?
Some of them, yes. Some of them definitely. Nowadays, there is more awareness.
Yes.
I've seen a lot of injuries in the so-called, celebrity
Yes.
fitness and gyms.
Yes.
So I've operated on several of them. And the word, it's a word of mouth. And so people come back and say, can I do these activities?
Yes. Yeah.
So let's look into the risk factors of ACL tear. Young females are more prone, especially athletes, using faulty movements, use of oral contraceptives in premenopausal women, post-traumatic osteoarthritis. And these are the images where we can true cut images, we can get it through the MRI diagnosis. So torn ACL over here and the normal ACL is here.
So
Over to
Pushpa,
you.
you can go back to the 6th slide. We also would like to have a few insight from sir. Like here, post-traumatic osteoarthritis, sir. If we are talking about post-traumatic osteoarthritis, is it just because of ACL or maybe some secondary pathophysiology?
Post-traumatic osteoarthritis is not exactly a risk factor for ACL injury. There is already arthritis,
Yes.
there is pain and stiffness.
Yes.
So now, in trauma or in injury, there could have been an ACL tear. ACL tear, if not treated, can result in post-traumatic osteoarthritis. It is the other way around. Okay?
Yes.
So, do you also advise some preventive measures for the females who are premenopausal and going towards a postmenopausal era? So
Yes.
should
Those
they take
who
any
are
calcium
in
supplement?
their late 30s, in Indian women, the menopausal symptoms start very early 40s. So this age group women should focus on two things. One is their diet. The second is the fitness regimes. As the woman goes from 20s to 30s to 40s, in India especially, their diet changes drastically. They start giving up protein diet, whether it is religious or cultural, for many other reasons. So one has to understand that as long as woman has got her hormones intact, they are protected. These hormones are anabolic. They will protect their bones and muscles. Once the menopausal symptoms start, there will be fatty degeneration in the muscles. The bones will start getting osteoporotic. Now, bones and muscles, 90% is made up of protein. So where do you get your proteins? From meat, from eggs, vegetarian food like soya, paneer. So that's one aspect. The second aspect is to focus on the fitness regimes. A lot of women, they say we are doing yoga. Yoga is a low intense threshold exercises. It will only give a good feeling, but it will not give any strength to you. What is more important is weight bearing exercises. When I say weight bearing exercises, brisk walking, running on soft surfaces, for upper body weights, these are very important.
Thank you so much for giving those tips, because I see Pushpa smiling and I myself was smiling as well. Maybe I am the yoga master and who believes in doing yoga, but I'll take your preventive tips. Thank you so much for that again. Over to you, Pushpa.
Yes, sir, true. And let's see the symptoms. So when there is ACL tear, so swelling in the injury is fresh, locking, wasting of thigh muscles, instability, lack of confidence to the sports and running. Yes, over to you.
So these are the symptoms as you have already told us. And this,
Yes.
what is this locking type of feel, sir, for this ACL injury?
Swelling of the knee is because of blood collection, what we call hematoma or hematosis. Okay. Now, locking is exactly not a typical symptom in ACL injury. It can happen if the stump of the ACL gets stuck between the thigh bone and the leg bone. It is more a symptom of meniscal tear, right? Wasting of the thigh muscle, you will not see in the first few weeks, but 6 to 8 weeks down the line, you will start seeing the wasting of the thigh muscles on the inner side, on the medial aspect. Instability can lead to lack of confidence to do even basic walking, brisk walking up and down the stairs, or walking and changing the direction. People lose confidence sometimes. These are the main symptoms.
And we see them, taking the support of crutch and single stick, and then they do resume their office activities and all. I think yes.
True, absolutely.
Yeah. So yes. I think, sir, this is like ACL injury, and as I was understanding the slides which is been sent by you, we see doctors coming and doing this test, and by doing the make of this slide only, we could understand that this is a draw test, anterior draw test, and is this a kind of very crucial physical examination before any imaging is done?
Now, whenever patient says I got ACL tear, it could be a full ACL tear, but the patient might not have any instability. Right? So it is very important to do your assessment in the clinic, anterior droits test, and there's another test called latchman test. So we assess and see whether the leg bone is coming forward. So if it's a thigh bone and it's a leg bone, while doing anterior, is it coming forward? Right? Yes. And there are different grades of droits test, 1, 2, and 3. And based on that, we decide whether the patient needs an MRI scan and whether the patient needs any surgical intervention.
So this is done before any imaging has been prescribed?
Yes.
Yeah.
So now the very important slide we can see for our nurses. What are the responsibility for the nurses before patient is going to the surgery? We need to follow the pre-op checklist where strictly, now I will read some of the parameters for the pre-op checklist. Especially we need to obtain the consents like anesthesia, procedure, high risk, a blood transfusion consent, and etc. And we need to look into the patient's comorbidities like diabetes, history of known case of diabetes and hypertension also. And we need to look after the blood labs like virology, all these things. Especially physical preparation is very important for the nurses, like chloroquine bath to be given prior to the surgery, no ornaments, and we need to offer a patient to the OT attire also.
Yes. And so, sir, you will agree with all these parameters which is followed by the nurses, and anything specially you would like to tell the nurses here? Sometimes some non-compliances we only find during the intro. So anything else you would like to tell?
Pushpa touched it rightly. Skin preparation, very, very important. Ours is a tropical country, so the temperatures are usually high. The bacterial count is high. So they come from far off places in public transport. So there is contamination.
Yes.
It's very important once they come into the hospital that they change their dress, have the chloroquine bath, and then get to the theater. For the staff on the ward, apart from the virology, blood tests and all, they should be aware that the radiology, the MRI films and the reports are available.
All the reports, yeah.
It is one of the common errors for the patients not to bring the films. They bring the report. That is not enough. Right? As I said before, the knee might not just be an ACL injury. There could be meniscus. There could be other ligaments. Yeah. So when we go in, sometimes it's a surprise, like, oh, there's a meniscal tear. I don't have the equipment now to repair the meniscus. So everything changes. In the theater list, sometimes they might not put up the complete details of the surgery. So this is where mistakes happen, and this is where the nurse says, it's a very simple thing. Do you have all the radiographs? It's a checklist.
Yes.
And then inquire, are we doing the right side or the left side?
Yes, right side, yes.
Cross matches, check it with the pre-op note, with the clinical note. So these are the basic principles which the staff on the wards have to follow. Okay.
So we request all the nurses, as sir rightly said, whenever there is a handover process, you can just not only hospital reports, even patient may bring a few OP reports as well. All the imaging, radiology imaging have to be properly handed over. And now Pushpa is going to speak about IPSG goals, a few enlightening about it. Yes, Pushpa.
Yes, sir. We can avoid all the errors by following all these 6 IPSG goals for the patient safety. All these are especially for the identification patient correctly, improve effective communications, improve the safety of ILR medications, and ensure correct site, correct procedure, how sir said. So we need to follow this all 6 IPSG goals, sir. Let's see.
Pushpa, can you tell me what IPSG is, the full form?
International Patient Safety Goals, sir. These are the 6 goals we are following, sir, as per the JCI.
So we would like to understand from you, Pushpa, that what do you mean by improve effective communication? That's what we were talking about, the handover. It
Yes,
is
sir.
between ward nurse and the pre-op nurse and the further OT nurse.
Yes.
Don't you think so? Yes.
Yes, sir. So, ma'am, this is 12.
Yeah,
And
so-
one of the communications is to check whether the patient is fasting or not.
Yes.
Very important.
Yes, sir. That's all we'll cover in the S bar also, sir. That's how we give handover to the pre-op OT recovery, OT unit, sir.
So that is why we also have the NBM display board.
Yes.
By mistakenly, if the FNB boy comes and offer the food, also patient will be educated, and the board will also resemble that yes, patient is NBM, and they can always cross-check with the nurses. This practices should be always, told upon to the fresher nurses and the senior nurses. By the senior nurses.
Let me interrupt.
Please.
Now, usually the communication levels, how the mistakes happen. The analyst says no food. The patient will have a nice cup of coffee and says, I did not have food.
But I had coffee.
Nobody told me not to have coffee. That's a liquid. So we have to be very clear.
Yes, very genuine, sir. Very, very, very evidenced. Yes.
Yes, sir. Next, ma'am, over to you.
Yeah, no, sir, I can see this as you have, guided me with the slide. There is a graft fixation. Until yesterday, we would not even know that graft also is being placed. We thought it is only the reconstruction repair by the handing of arthroscope and all. This is again very good, technology and practices which you would like to know from me.
Right. Now, ACL surgery, it is not a repair, it is a reconstruction. Repair is where the original ligament is stitched up. In knee, for ACLs, it does not work. So we have to do reconstruction, which means we have to take material from somewhere else in the body. So there are different tissues available. The 2 common tissues are hamstrings. Hamstring muscles are at the back of the thigh, on the posterior aspect. There are 4 hamstring muscles. So we take 2 of these muscles, fold them into 4 and fix it. You can see the slide on the left side. The blue is just a marker to indicate the length. Yeah, that's right. Okay. That's a hamstring graft. Now, hamstring graft, the incision are smaller, right?
Yes.
But it takes longer to heal. It slightly stretches, so it is slightly weaker as compared to the BTB graft. What is BTB? It is bone, tendon, bone graft. So we take a piece of patella on the kneecap along with the middle 1/3 of the tendon on the front of the knee joint and the leg bone, a piece of the leg bone. So we are taking bone and tendon. The wound is bigger, but the graft is much stronger than hamstrings. Number 1, because it's a bone-to-bone healing, the recovery is much faster. Hamstrings takes around 9 months, whereas BTB graft takes less than 5 months. So I usually keep the BTB graft for revision surgeries or for sports, top elite athletes. So there's a difference between the two.
So should the athletes or players should go back to return to sport, or maybe they'll have to wait till 5 to 9 months as you indicated?
2 things. 1, when we do the surgery, the physiotherapy starts. Physiotherapy is to allow the patients to get back to normal daily activities. Normal daily activities does not mean sport. To get back to sports, there is what you call essence therapy. Now, there are certain criteria the patient has to fulfill before they can go back to sports. So it does not mean like if the patient has BTB, I will go back to sports after 5 months. No. They have to go through certain trials.
Yes.
If they fail, they have to redo the physiotherapy, redo the fitness training. Then only we allow them to go back to sports.
Yes. We will also see the recovery criteria in the later slides. Yeah. So 13 is again, as you said, this slide again, maybe post after surgery, you see this again, the compliance of anterior draw test.
Yes. I do check after surgery, yes.
Yeah.
So let's see the post-operative care, extended post-op care. Toe touch when after the surgery. So we'll start with the physio. Toe touch wear bearing, walking with walker support, non-weight bearing or partial weight bearing 4 to 5 days for 4 to 5 days. And physio interventions also like we will start with the dynamic knee brace like RM exercises, range of motion of exercises also. So immediate post-op care, this is a core practice for us. So we need to check for the ensure safe patient position in the room, vitals, and as usual, we will pain manage to be done as soon as possible. DVT drug injectables to be must injected, and continue the analgesic infusion via epidural line. It's a like standard of the ACL protocol. Hygienic care and toileting needs to be assessed for the patient. And if the patient is able to manage to take the diet, as according to the patient condition, we can provide a diet also.
Anything else you would like to give from your answer for immediate post-operative care where nurses should be?
Can we go back to the previous slide? One more. This one, right? Now, post-op care after ACL surgery depends again whether we have repaired the meniscus, whether there's any cartilage injury. Okay. So if it is an isolated ACL injury, I allow partial weight bearing straight away. Okay. No toe touch, foot on the ground.
Okay.
And 0 to 50 degrees of movement, right? For isolated ACL injuries. If there is meniscal repair, then for the first 10 days, I don't allow knee bending
At all.
Give rest. And then we start 0 to 30, 0 to 50, 0 to 90 over 6 to 8 weeks. So the treatment, the physiotherapy regime changes according to what the problem is and what surgery has been done. Okay.
So having these braces on, patient can still go to the toilet
Yes.
and partial squat, like commode squat. He can.
Yes, of course, yes.
So what complications can we see in this ACL? So higher risk of developing osteoarthritis in the knee, even after post-surgery. Recovery period 8 to 9 months. So the RTS is not but return to sports. Ma'am, over to you.
So sir, like as you were mentioning 5 to 9 months, can they resume driving and all, if at all the car is not automatic? Anyways, also we have to paddle the brake. So do they refrain from driving?
Whether it is right knee or the left knee, whether it is manual or automatic, I allow the patients to drive the car after 4 weeks.
Oh, great.
Not 9 months. No, after 4 to 6 weeks, it is quite safe to drive the car.
Okay.
Not a two-wheeler.
Yes, of course. Yeah.
Two-wheeler is off for 5 to 6 months.
So the criteria for recovery is minimizing knee swelling, retaining kneecap stability, regaining full range of motion, strengthening the muscles of the quadriceps and hamstrings. So
preventive, as we have come to the prevention now, sir would like to add few of your points from your answer, this preventive aspects.
Can you go back to the previous slide just once?
Yes.
Yeah. The recovery you mentioned correctly, minimizing knee swelling. So the staff on the ward, they need to know that ice therapy is very important, cryotherapy.
Yes.
Right? Full range of movement is very important before you start strengthening exercises. And between the quadriceps and the hamstrings, it is the hamstring muscles which need more strengthening than the quadriceps for ACL surgery, after ACL surgery. Okay.
Yes,
now the preventive aspects, true, weight is very important. We have to have a balance. It is not just warming up. The reflexes have to be good. Having adequate fluids, now that's not mentioned here. If the body is dehydrated, the ligaments, they are quite stiff. they just snap if you play sports. So rehydration is a very, very important step before you start doing the sports. Okay. If there is knee pain, it needs proper assessment whether the problem is inside the joint or outside the joint. All knee pains are not knee pains. We have to understand that the knee pain can come from the hip joint. It can come from the back. So assessment of these two joints are crucial. Sometimes we see patients complaining of severe knee pain, but there is very severe arthritis in the hip and they don't have any problem, any pain in the hip at all, what we call referred pain, right? So we start telling the patients, don't put weight, don't do any exercises for the knee and all. So do the assessment properly. Okay?
So yes, sir. And thank you very much. We have come to the end of the session, and I think that was very, very simple, giving all the informative ideas and checkpoints of what nurses should be able to do when they receive this pre and post-operative ACL injury patients. Thank you so much, sir, for your very, very valuable time. And thank you, Pushpa, as well.
Yes,
and
ma'am.
that's how
Thank
we
you so
end
much.
the session today. Thank
Thanks,
you.
Shanti. Thanks, Pushpa. All right.
Thank you,
Thank
sir.
you.
Thank
I
you.
was talking to one of the to Sunita this morning.
Yes, sir.
So the staff should come up with questions. Okay.
So I have one question, sir.
Yeah, go ahead.
Yeah, when this cryotherapy till when we can continue the at the home? I mean, sir, like we need
After
to
surgery or after injury for the first 2 weeks.
first 2 weeks. Okay.
Once the inflammation settles, then you switch over to warm packs. Okay.
Okay, sir. Great, sir.
So,
Thank you
and
so much.
sir, do you also give the practice of elevation 45 degree, once we receive the patient immediate?
No elevation,
No.
just one small pillow is enough.
Okay, yes.
We don't need significant elevation that causes a lot of edema in the foot and ankle.
Yes. Yeah. Thank you
Yes.
so much, sir. Thank you. We end the session.
All right. Okay. Take care.
Thank you. Take care, sir.